Hello everyone. Hi Aisha.
Hi, Omi.
Welcome to the studio again.
Thank you.
How are you?
I'm doing good. How are you doing today?
I'm doing well, thank you.
Good.
So today we are back again. I want to ask you about periodontal disease. What is periodontal disease?
Periodontal disease is the disease of the gums. When your gums become puffy, bleeding, and it end up with tooth loss. There's a lot involved in periodontal disease.
And what are the basic things? What are the things that can get you to the stage of periodontal disease?
Poor oral hygiene and not having dental cleanings done, not brushing properly. And the other factor in a periodontal disease is also hereditary. Sorry, you can inherit it also from your parents.
Oh, okay.
And poor hygiene is the majority. Hereditary is also there, and it's also transferable. You can get periodontal disease from someone.
Oh, really?
Yeah.
By kissing or?
Yes, by kissing. By kissing with people. It's a disease that's transmittable.
Okay, so this is very interesting, and it's very good for people to know because most people don't know. Meeting everybody, anybody, kissing everybody, or anybody. I think it's very important for us to be, cautious. So, Aisha, periodontal disease. What are some of the? Is it one side of the mouth, or sometimes once it's affected? The gum, is it going to be all of the gum of the mouth at the same time, or it can be some part of the?
It's all over. Periodontal disease, sometimes it's severe in one area than the other, but when you have a periodontal disease, because it can be transmittable, one side can affect the other side in your mouth as well. And how you know that your mouth isn't healthy is bleeding. Healthy gums don't bleed. When your gums bleed, your gums are not healthy.
So how does it bleed? Is it when you brush your mouth, or how does it happen? Like,
when you brush your mouth, when you spit, you'll see blood in your saliva. Something is coming up. If your gums are healthy, healthy gums don't bleed. Your gums are not going to bleed if they're healthy. But when you bleed in, either by brushing or either some people, even if they touch their gums, they bleed. Your gums are red and puffy. Sometimes it happens also, I forget to mention this, it happened with pregnant women. It's because of the hormonal changes, they end up with a period disease whilst they're pregnant. In that, what you should do is you should just go and have a cleaning done every 3 months regularly until you have your baby. But majority of the people have it because of poor oral hygiene. And what it end up happening, periodontal disease, a severe case, you end up with tooth loss. Bone loss first, because like your bone will start to move up, and then your tooth will start to wiggle, and you will lose your teeth.
So when that happened, to replace that and to do a treatment for the periodontal disease, the gum disease, what needs to be done?
You have to see a periodontist, you have to see a specialist, a periodontist it depends on how severe your case is. Some cases are far gone, the periodontist can do nothing. Some cases are in a place whereby they can restore your teeth back. You have to do grafting. They have to graft. They have to put bone. They call it bone grafting. They have to put bone grafting, and they have to graft. Some people, they will just take the artificial membrane. Some of them, they will take from the top of your mouth. They will cut a skin from the top of your mouth and then sew it onto your gums to bring your gums back up again. Because when you have a periodontal disease, you lose bone and your gums move back down. So they have to bring the gums up again for everything to look normal. It's possible if your case is not severe enough. If your case is severe, it's a bigger problem, because you're gonna end up with losing your teeth. Your tooth will start to wiggle, and before you know, your tooth will start to fall out.
So is there at some point, since it's affecting the gum, is there at some point that it's not a win-win situation? You end up getting not an option of even fixing it. Have you seen those cases whereby when it gets to certain level, it will not be fixed?
Yeah, I have seen those cases when it gets to a certain level, you can fix it. It results in tooth loss, and then you have to go through the option of having an implant done, or having an option of getting a denture. It goes to a point whereby your teeth are wiggly, your teeth are moving, they're all mobile in your mouth. You cannot even eat properly. Your mouth starts to hurt, so you can't do nothing about it. You have to remove them, and then have the option of a denture or have the option of an implant. Implants are not cheap, but they're the best option. But if you can't afford implants, you go with the denture route.
Okay. So with the gum diseases, still, if it happens, you can still do implant. But is there a case whereby it's well affected? It cannot be. You can even have the option of doing implant.
Implants go in the bone.
Mm-hmm.
But your gums have to be healthy too, but implants go in the bone.
In the bone, okay.
Usually, mostly is the health of the bone that's gonna make your implant last long or not.
Okay. Mm-hmm.
If your bone is porous and your bone is not strong enough, some people are not candidate for implants. They can't have implants.
Okay.
You have to do, they call it a CT scan. You have to do a CT scan before the implant, and you will be told what you needed, whether your bone is good enough, whether you have a good enough bone quality to do implants. Some people can't even do it. They don't have a good enough bone quality to do implants, so they have to get a denture.
Thank you, Aisha, because that's what I wanted to know. I wanted to know whether people get to a point whereby they don't have an option of even having the implant done. And this is very important for the society, because a lot of people are going through this. Not everybody can afford going to the dentist. So once again, thank you very much for coming to the studio. Like I said, this is your studio, this is ours. So you are welcome anytime, my dear friend, my dear sister. Thank you.
Thank you very much for inviting me. I'm honored. Thank you very much.